Thank you, everyone, for joining in. Good morning, afternoon, or evening, depending on where you're calling from. And my name is Megan Silvestri. I'm the Stability Network's interim executive director. And at the Stability Network, our mission is to inspire and encourage all people to be able to thrive with mental health challenges. And we do this through storytelling. And so thank you for being with us today to learn from the amazing Angelica Mukrango about her story and her latest advocacy work developing community mental health services for young women in Zimbabwe. So Angelica Chiqueta Mukrango with us today has lived with obsessive compulsive disorder since the age of 17. She is the founder and CEO of Zimbabwe OCD Trust, an executive committee member representing Zimbabwe with Global Mental Health Peer Network, a stability leader with our very own Stability Network, a member of the Pan-African Network of Persons with Psychosocial Disabilities, and the co-founder and chairperson of the National Association of Persons with Psychosocial Disabilities in Zimbabwe. And lastly, she's contributed immensely in consultation on lived experience with the World Health Organization and United Nations. And so just a word about today's session before we jump right in. We'll spend about 20 to 30 minutes where Angelica will respond to some questions that we've prepared, and then we'll open up the floor to hear what questions you all would like to ask Angelica. So you can begin sending in your questions at any point in the conversation, and then we'll get to those in the latter half. Great. Hi, Angie.
Hi, Megan. Thank you so much for having me.
Thank you so much for being here. Can you maybe start us off by sharing a little bit about your personal journey with mental health and what has led you to become an advocate?
Yes, Megan. As you said, I started noticing that there was something going on with me around the age of 17. And I really couldn't, talk to anyone about this. It was scary and I was confused and I didn't know what or where to go. So I just carried on with my life, struggling along. And I went on to university still with those problems and so on. But it really got worse when I got married and I had my daughter. And that's when I think I started, it started off with postpartum depression, and then further went on to just, all those horrible intrusive thoughts of obsessive compulsive disorder. And again, I couldn't share, not even with my husband or my family members, my mom, my sisters, I couldn't, because this was something I'd never heard of, that I could have such horrible thoughts. And my parents were, well, right now they're late, but they were very religious, the Catholics. And I also went to Catholic schools and so on. So it was so confusing. And later on, after about 30 or so years, that's when I said, no, this can't go on, because I was sad all the time. When you just feel that you're not living, you're just existing. And that's how my life was. My daughter was there, beautiful and so on, but I could never enjoy her because I thought something bad was going to happen to her. We could be on holiday, having fun, but I was always sad, afraid that something horrible happened at home and things like that. So I finally Googled and discovered that this was whatever was bothering me had a name, and that it could be managed. So wow, it was amazing. It was amazing. I went to a psychiatrist. We talked, and he put me on medication. We did therapy, just talking about it and so on. And the more we talked, the more I realized that life, there is life out there. there is life beyond this disability. And I also wanted to talk to people who had gone through what I was going through, because, you know, with intrusive thoughts, they can really be frightening and traumatic. So I tried looking for an organization or a support group where at least I could talk to people who were experiencing the same thing, and I couldn't find any. Absolutely nothing. And even when I tried to talk about my experiences, a lot of people didn't believe me because they never heard of OCD, or rather, they never heard of Africans suffering from OCD. So, they'll tell me, no, that there's nothing like that. That's not an African disorder and so on. But then I started just digging, reading and looking and so on. I discovered, well, there are lots of people with OCD, only they didn't know what it was. And some were too embarrassed or too scared to talk about it. Or some thought they were bewitched, or, all those funny stories that you hear. And then I realized that no, actually people in my country needed help. They needed help because, and if no one is talking about it, who is going to start talking about it? And that's why I started the organization, Zimbabwe OCD Trust. And I just started talking about this disorder. And I remember that some of my family members would say, no, you can't talk about it. You don't talk about such things. But the more I talked about it, I felt happy. I was free. I was no longer hiding from people because I was afraid that, before I'd be afraid that maybe people can see my thoughts. So the fact that, I started talking about it and I was feeling good about it, the more I even, started going to other places and talking to people and so on. And right now our group has grown, and it has all sorts of people, from young people, elderly people, and so on. And we actually, just trying to help each other, giving each other support and so on. So yeah, that's how it was started. Because, well, we have to start somewhere. Yeah.
Thank you so much, Angie, for sharing those pieces of your story with us. And I just imagine being one of those frontier individuals, really bringing light to something that doesn't really have a name, it seems, that's so hidden. Bringing light to something that's maybe so hidden takes extra courage. So thank you for doing that and being that light in the space. I'm going to shift a little bit I want to ask one question related to the pandemic, because we know that the pandemic has really massively had an impact on the mental health of individuals globally. And so I'm curious, for what you've observed, are some of the mental health consequences of the pandemic that maybe aren't widely talked about in Zimbabwe, and how do you see them being addressed in your community?
One thing for sure is that although in Zimbabwe, the impact of COVID-19 has not been felt as other countries. People did die, people were affected, but it wasn't as bad as some of the countries in the world. But there was a lot of changes took place. The shutting down of the country, people losing their jobs, people losing their livelihood. Most of the people in Zimbabwe actually are self-employed. You find that we do have people who are employed, in big organizations and so on, but you also have a lot of people who are doing their own work. So when the country was on lockdown, it meant that these people stopped working. It meant that they couldn't sell their wares. They couldn't, go to the places where they work and so on. So there was a lot of, I can say, a lot of people suffered from poverty, actually. Right now, people are suffering from poverty because they lost their livelihood. So that bit is actually one of the biggest things that has happened to people. And then you also have a lot of people who suffered from anxiety and depression, again, through all this, the lockdown, and anxiety because, people didn't quite understand how this COVID-19 was going to spread. And there was a lot of misinformation about how some people just wanted to reduce the population in certain areas of the world and so on. So there was a lot of anxiety, schools closing, kids not going to school. And therefore, it also brought some other problems that were never that bad. Drug abuse. Oh my God. Because especially in the young people, there is just so much misuse of drugs, and they're going crazy. They're going crazy. It's sad, actually. It is sad. So all those really, those are things that are affecting people. And what can we do about it? It's difficult. It's difficult. The economy, some people are still struggling. People lost their jobs. So we are yet to see how we'll get out of all those problems. And then school kids, some are back at school. And there was also a lot of teenage pregnancies. And that, again, is a tragedy. You find that all these kids are now pregnant. They're supposed to be going back to school. Then what do we do with them? And with drug abuse, I feel that we're actually going to lose a whole generation. A whole generation. There's lots of suicide. There's a lot of, youngsters stealing from their parents so that they can keep buying these drugs, and that is sad. And you also have parents who are now also depressed, or because now they're wondering what to do with the children who are on drugs. So you can actually find almost the whole family, everyone is not well because of whatever is going on with the children and so on. So it's a bit of a mess, but we keep hoping that things will change. We keep hoping.
Do you see any of this being addressed in any positive way?
Oh, yes. Oh, yes. The president actually and the different ministries, they did realize that it was an issue because at first I think they were not saying much about it, but the hospitals, the psychiatric hospitals are now getting full, and most of the people there are actually youngsters. And there's also been quite a lot of robberies and so on. And they are noticing that, no, this is a problem. So they're trying to address the issue, right, to try and see who is bringing in these drugs and to try and see if these people can be rehabilitated and so on. And most of the youngsters, what they say is that with some of the drugs, what they do is once they take them, it means they can sleep for long periods. They don't have to eat. They can eat maybe once in 2 days and so on. So they think that it's sort of solving their problems, but really, they're just destroying themselves. They're destroying themselves. It's sad. It's sad.
It's very sad. Well, thank you for sharing that and giving us some idea of the landscape. And I could ask more questions about that, but I'll keep us on track and keep the focus on the good work that you're doing. So, but thank you for giving us that scope into what's happening. So I want to turn us back to and ask about this organization that you started that you mentioned, Zimbabwe OCD Trust. Can you tell me about the mission of the organization and why you're passionate about this work?
Basically, when I started, it was just to raise awareness and to support people with obsessive compulsive disorder. And as I said before, the disorder is there, of course, but it's just that people didn't understand that it was a disorder. People took it as if it's something spiritual. And, you know, with people who suffer from OCD, from OCD, sometimes they have these vivid dreams and so on. And some of the dreams actually come true, you know. So for them, it was like, it gives me, you know, I'm powerful. You know, some have been to know you're a prophet because you can foretell what's going to happen and so on. And so it was mainly to raise awareness, to say, no, what you're missing out is much more than having those dreams and feeling as if, you know, you've got some power of some kind. And the OCD is there, they've got names for it in our languages and so on, but now try to convince people to say, okay, no, you don't have this fancy thing that you think it is. It's actually a disorder. Wow. You know, it's been a tall order, but at least I'm happy that, you know, a lot of people are coming forward and saying, no, I've been to prophets, I've been, they tried to remove the demons in my head, or I have been where, and, you know, things are not working out. But what you're talking about, what you talk about, it makes sense, you know, when we start talking, and then I explain exactly what it is, and then I explain to them that, no, if your symptoms are really bad, go to the psychiatrist, go to the psychiatric hospital and get help. So what I also noticed is, besides just raising awareness and support, there were a lot of people who were sort of stuck somewhere. You know, with OCD, sometimes you lose your self-esteem. You actually just, you know, you close yourself out. You know, in most cases, you don't even want to go out there and meet people. And so you find quite a lot of people are not really outgoing, or they couldn't carry on with whatever they were doing. And then you also have other people, again, it's not just people with OCD, but because our country, if I tell you that we are 16 million and we only have 17 psychiatrists, registered psychiatrists, and less than 30 clinical psychologists. And you're talking of in a country of 16 million people. Wow. So you find that if anyone who is having a mental condition or a crisis, as long as someone is willing to listen to them, they'll come forward. So I listen to anyone and everyone who comes to me with a mental condition. And you find that there are some people who never really went to school, or they went to school, but they couldn't find a way to start living. Either they're being shunned by people in the communities, or they just didn't get enough support for them to go out there and do something for themselves. Or some maybe were working, and because of their conditions, they were dismissed from their workplaces. So that is one of the things that I really want to do, to give these people confidence to go back, to give them skills, to give them, just confidence, so that, the right to life. Everyone has got to, it's our right. We're born with it. It's not like you have to, so it's something that I want people to understand. Everyone deserves to live a life. Everyone deserves to be in their communities. They deserve to, be part of a community and do something for themselves and be happy. So yeah, that's what I'm trying to do.
Thanks, Angie. I feel like that's the perfect segue into our next question, which is what you're now starting. and you're really in the midst, from what I'm aware of building this vocational training center for girls and women with psychosocial disabilities called Mangwanani Home of Hope, right?
Yes.
Can you tell us about your vision and kind of where you're at in that building process?
Yes. So what I have done is, my home, I was born in the village in the north, in an area called Mashonaland West. And this was my parents' home, and it was a lovely home and a happy place and so on. And my parents are both late. I've got my brother who is not living in Zimbabwe. I've got another sister and nephews and nieces and so on. And so when I started all this, I said to myself, but what can I do? What else can I do besides raising an awareness and support? So I decided, no, the best thing to do is at least, start a vocational training center, rehabilitation and vocational training center where people can come for a short time, have build some skills and so on and go back to their places. So I'm trying to do it the way that all over in European countries, in America, in Australia, and so on, where people are utilizing agricultural farms as a base for promoting human mental health and physical health and social well-being. And on farms, the animals, the plants, the garden, the forest, and the landscape are all used in recreational or work-related activities for patients with mental health conditions, or for people with learning disabilities, or people with drug history and so on, or even problem youths and so on. So working on the farm will actually just contribute to one's self-esteem. They will also have learn social skills, rehabilitation, inclusion in the society. They'll learn responsibility, physical health, and a sense of purpose. And it's in most countries anyway, it's recognized that all these, I know that some people call them green farms, some call them social farms, some call them care farms, and so on. They provide the space, the quietness, and, just being there, you start, you always find work to do. You do this, you do that. There's just diverse activities and caring activities. For example, if one is working with plants and animals, and the environment, it just gives someone, just a sense of family and social community and so on. And you also find that being socially connected at the farms, it provides a non-threatening opportunity for social interaction. The focus on the work on the farm means that connections with others are not the focus of the activity, but rather a byproduct. For those suffering from mental ill health, this can take the pressure off social interactions, because that's one of our main problems. We just don't want or are afraid of interacting with other people. So the attention is no longer solely on the individual, but instead on working together on a task at hand. And that actually sort of brings healing. And where these tasks involves giving attention to the needs of animals and plants, there's opportunity to regain the ability to care and consider others, and a vital function for healthy human relationships. So furthermore, you find interaction with animals is already established as a mechanism of reducing stress and anxiety. And then you also find that it allows the opportunity to build skills and, importantly, gain self-efficacy that comes from learning and implementing these skills. Gaining such skills can actually bring, it can bring, the sense of well-being to a person. And then, of course, you also find that the physical activity of a person is also important. Let's say some of these people were locked up in their rooms and they were not allowed to go out and so on. It means, of course, their life expectancy would definitely be reduced. But now the physical activity actually, I think we all know that it links very well with mental health, physical activity, mental health, and working on these farms will provide opportunity for physical activity. And it is the advantage that it is not undertaken purely for the purpose of doing something physical, but instead it is performed almost unconsciously as part of ordinary farm activities. And feeling physically tired at the end of the day is a positive aspect that will help them to sleep and provide a sense of achievement. So yeah, that's what I'm trying to do. That's what I'm trying to do. And I've always loved the country. It's so beautiful, it's peaceful, and so on. So I'm hoping that, these young people will have a chance to just find themselves and heal and go back to their communities and be someone. And if we're also trying to move away from the charity kind of rehabilitation, but let's look at what we call a person-centered recovery system, where a person-centered recovery approach, where we look at the person as a holistic person. What does the person want? How can they recover? What would they want to do after they leave the rehabilitation center? How can we help them? Can we place them somewhere? Can we help them start some small business or whatever, so that at least we are with them along the way as they move forward?
Thank you, Angie. That's such a beautiful, beautiful vision that you're really starting to make a reality. So thank you so much for sharing. And I want to ask, so for anyone who's listening now or watching back on our blog that's hearing this and wants to maybe support your work, how can they follow along? Or I don't know if you're receiving donations, but how can someone find what you're doing and get updates and maybe support your work?
Okay, at the moment, we are working with Giving Way, but as we go towards this what do you call it, Giving Tuesday, so we'll also be talking more about it and so on. And if someone wants to donate through, I'm sure if they want to donate through Stability Network, I'm not sure whether that is possible, but I'm sure that could also be another option. But you can also find us on our website in case you need to communicate, www.zimbabweocdtrust.org. We are also on Facebook, on Twitter, and LinkedIn. So we are out there on the social media.
Okay, great. Thanks, Angie. And we'll get those links, all those links from you, and post them when this is posted on the blog, so that anyone listening back to this later can click on those links and find you. Okay. Great. Well, I do have another question, but I want to start taking questions from the audience if there are any. So please go ahead and start sending in your questions so that we can try to get to those. I'll ask one more and we'll see what questions are coming through. Angie, what words of encouragement do you have for anyone who is struggling with mental health issues right now in Zimbabwe or anywhere in the world?
Well, you're not alone. I think that's one of those things that, everywhere you go, you can say you're not alone, because wherever I go and I start talking about mental health, I discover that there's so many people out there who have issues but they just are not comfortable talking about it. They don't want to talk about it. And I think we should all just realize that this is something normal. If you can have a heart problem, a kidney problem, eyes, I mean, we are wearing glasses and so on. So there's nothing really out of this world that someone has got a brain problem, it can happen to anyone. And just because it's not happening to you right now doesn't mean it will never happen. So we should just embrace each other, help each other, and just know that it's normal. It might look frightening at first, but if one seeks help early enough, you can actually live a normal life. You can thrive, you can look after your family, you can work, and so on. So it's not to give up, and not to give in to stigma as well. And in Africa, what I've noticed as well is that we've got this, anything that we don't understand, we start saying it's spiritual or it's witchcraft or whatever. Let's not keep going there, and let's not play this blame game, because if you're saying witchcraft, it means you're going to start blaming someone else, isn't it? For doing this to you. But let's start by embracing, what this is normal. Let's embrace that first. Let's look at that first. And then afterwards, maybe, I don't know, but there's no afterwards. Let's just get help. Let's get help and live a normal life. Because all these are the things that we start thinking about. It actually draws you back, because you start, you start living a miserable life. And you start being afraid every time of people, because you don't know who's done what to you, which might not really be the case. So let's get help. It's okay. It's okay not to be okay, but you can get help and you can live a normal life.
Thank you, Angie. That was really comforting and encouraging. I know even for myself, it can be so isolating, and so no matter how many times you hear you're not alone, it's comforting each time, I think. So thank you for sharing that. All right, we'll get to some chat questions. Someone asked, knowing what you know now, what would you tell your younger self?
It's important when you don't understand something to talk about it. Talk to someone about it, because it's really not worth just being scared of something and not talk about it. I think that's where right now probably the generation that is coming up now is in a better space, because right now we are now all trying to talk about mental health. So if, let's say, they do see that there's something going on, they can approach someone. But then, wow, I couldn't even talk to anyone. And I'd have said, Angie, just go ahead and talk to someone and tell someone that you're having issues and seek help, and don't be afraid. Don't be afraid. I think that's one of the things, not to be afraid, because I think that's what everyone is afraid of. Afraid that you'll be told that you are mentally ill. Which is funny, because yes, you have a mental condition, but we shouldn't be afraid of that, because if we're afraid, then we don't get the help that we need.
Thank you, Angie. Yeah, exactly. This is a really interesting question that came in. What was the tipping point after 30 years of suffering from OCD that made you Google your challenges and discover what it was you were dealing with, and what caused you to finally get help?
I think it was more of the constant sadness, the constant, you're trying every day, you want to be happy, and every day you wonder, is this it? Is this what life is all about? as well as some of the actions like where I had all these urges of stabbing my daughter, and then I started drinking because I felt I didn't want to keep having those thoughts and those urges. And then I think that's when I said, no, this is not right. This is not right. Because of all that, I even contemplated suicide because I said, maybe I'm better off dead than to keep living like this. What if I really do what what my thoughts are or my urges and so on? So, oof, it was horrible. It was horrible. And I just needed to find a solution. I needed to find a solution because it just didn't make sense. It didn't make sense.
Thank you for sharing that. We have several minutes left. I want to get these 2 more questions in. So I'll ask one more from the audience, and then I have a final question for you. So someone asked, what role do you see peer-to-peer support playing in young people's recovery at Mangwanani Home of Hope?
Yeah, I think it's all about just communicating amongst themselves. Because again, as people with obsessive compulsive disorder, the thoughts are really scary. So if they're able to communicate and talk about give each other peer-to-peer support and so on, it actually helps. I've never, it's amazing how I can be in a place, and the moment someone hears that I suffer from OCD, they just come to me and want to talk about their issues if they're also suffering from OCD. And in most cases, I ask, well, have you ever told anyone about this? And they say, no. I say, because I was afraid that no one would understand what I was going through. And so, if these young people can start, sharing their issues, and when they go back to their communities, also start their own peer-to-peer support groups, I think it will be really great, because that way they will always have someone to talk to, and they can, get more people to talk about their mental health issues, and life goes on.
That's great. Thank you, Angie. My final question for you today is, what is your hope for the future of mental health in your community and in our world?
I think a place where one is not afraid to say, I've got a mental health condition, where one does not feel stigmatized at all. And it's no longer an issue to talk about it. It should be just like any other daily thing. Oh, I forgot to take my medication. Oh, today I'm not well. It should really be an everyday talk, but not in a negative way, but we should be encouraging each other. We should be helping each other. We should, it should be a normal life, and kids not laughing at someone with a mental condition, or youngsters being ashamed to talk about it, and so on. So I just want people to enjoy life, and whether you've got a mental condition or a bad eyesight or a heart problem, it should all be the same. It should all be the same.
Thank you, Angie. Well, I so appreciate and admire you and just your story and sharing it with us today, and just all the work you're doing. That's really inspiring. So thank you so much for being here with us and for sharing. And thank you, everyone in the audience, for joining us. I just want to let you say any closing words if you'd like to, but really just thank you for being with us today.
Yeah, no, thank you so much, Megan. This really meant a lot to me. And again, the more I talk about this Mangwanani, the more I see the dream coming closer and closer. And I'm just hoping that, this is something that we can start at my village, and I'm hoping that we can actually do this in all the other provinces in Zimbabwe. And I've noticed that there are some people in the African countries who are also interested in something like this. So we're actually just trying to encourage each other to see, okay, let's have a pilot program, see how it goes, and then we take it up from there. So I'm really praying that this works, but I'm going to put my effort, 100% effort into making this. And thank you so much, everyone, for listening in, and, enjoy your Christmas. You're moving towards Christmas now.
Yes. Yeah. That time of year. Well, thank you so much, Angie. Take care, and we'll talk soon.
Bye, everyone.
Bye.
Bye.